Has a lot of cognitive symptoms that I have, and one of them being depression. I walked in here a depressed person, but I walked out of here 100% better.
When people think of Parkinson's disease, they think of the motor symptoms, the slowness of movement and tremor. But there are these non-motor symptoms that really can be just as debilitating, and one of the most significant is depression.
The typical treatments used to treat depression do not seem to be quite as effective in Parkinson's disease, suggesting that novel approaches may be necessary. That is part of the reason we're very excited to be trying this novel treatment program with ketamine.
At Yale, we've been conducting research with ketamine since the 90s, and we have reason to believe that ketamine will be particularly effective in Parkinson's because of how it works in the brain.
The treatment of depression with ketamine is one of the major breakthroughs we have seen in psychiatry in the past 5 decades. It's really changed the landscape, how we think about the treatment. However, when we're applying it to illnesses such as Parkinson's disease, we know substantially less.
Depression and Parkinson's together can have a profound impact on quality of life, and so that's why we're conducting this trial. We think that ketamine will be helpful for depression, but potentially other symptoms of the disease as well.
In depression, ketamine has been shown to have rapid onset of antidepressant benefit that can be sustained with repeated dosing. We're hoping to see similar effects associated with depression in Parkinson's disease.
I had something traumatic happen, and it just threw me into a tailspin, and I couldn't get out of it. So I participated in the program in hopes that it would help me. It was really simple. Actually, when I was getting the infusion for the treatment, I fell asleep.
If you or someone you know, a family member or a friend, is diagnosed with Parkinson's disease and is struggling with depression, please do not hesitate to reach out. The timeline for this trial is approximately 4 to 4.5 weeks, with the addition of a 1-month follow-up visit, and all participants are reimbursed for their time up to $1,400. There also is an option of participating in the imaging portion of the study, which is also an additional reimbursement up to $600.
Having the Parkinson's, I didn't really know what else to do as far as helping. And I find that participating in these clinical trials, the ketamine being one of them, I feel like I can contribute to the cure.